Later. So welcome in. Thanks for being here. I'm going to turn it over to my colleague Quinn, who's going to walk us through the agenda and the first section of the presentation today.
Hello, thank you everyone. I'm really glad to see everyone. And so for today, we are going to be going over just the PSAP services RFP. And so the agenda is going to be just the purpose and the background, funding available, and the PSAP core functions. And then we'll go over the proposal evaluation, the RFP deliverables, and KPIs. And so we'll go forward to background. So the Problem Solving Access Point program was established in 2022 in coordination with the Coordinated Access System in response to the 2022 gaps analysis to offer a strategic and near-term investment aimed at reducing the inflow of folks entering into homelessness and increasing the outflow into homelessness and to housing. Um, since we started, we've enrolled 3,700 households who have been experiencing housing crises, and we've been providing housing navigation, financial assistance, and other tailored interventions. Since the launch, we've served over 1,000 households for a variety of activities, including eviction avoidance, rental assistance, and essential furniture. So next we'll go over the purpose. The purpose of the PSAP program to so basically what the RFP is about, excuse me, is to establish 6 sites in the community because one of the feedbacks that we've received is that the community doesn't really know about this program in Sacramento County, and so we wanted to increase the visibility as well as do a revamp for next year. And so potential applicants who are interested in the RFP, um, we want them to be able to have the ability to handle 211 appointments and response and coordination. As some of you may know, that there has been a real increase in the 211 and getting some type of prevention, and so we really want to address this and help the community out. Prevention assessment and housing stabilization planning. Um, we want applicants to be able to conduct prevention assessments for referred households from 211 and deliver individualized stabilization plans for households, as well as hopefully be able to identify resources to avert entering into homelessness. Landlord engagement and mediation. This is a really important part of the PSAP program is being able to have communications with landlords and be a facilitator between the landlord and the household. Um, and that includes making payment arrangements and addressing any type of lease violations. And then the last one is financial assistance and resource navigation. It's assisting households with applying for rental assistance into the PSAP program, any type of utility support, connecting them to legal aid or um, any other community resources. So the next slide we'll go over is funding available. The proposed funding available will be from HAP and will be hopefully structured to deliver services across Sacramento County. The funding will cover personnel, operating costs, staff training, technology, and et cetera. The total funding is going to be 900,000 across 6 sites, and that should be for an annual for 75,000 per site. The contract term will run from February of next year until January 31st of 28, and the funding source is going to be half. Yes, and so that's per site, and then that's also per year. To answer your question, Christopher, yes, so the six sites, um, each staff will be at a site, at a specific site. And so,
Or, I mean, a provider can submit a proposal that would have six staff that could cover or serve six distinct areas. So you can provide either, right? It doesn't have to be, and there's some, provided you can demonstrate that you're providing adequate coverage across the county. So both options are acceptable.
and so the access to the pool is for total. So we're not asking for the organizations to actually provide the financial assistance. Sacramento Steps Forward will review the funds and approve it. And so the total pool that we are looking at is roughly around 10 million. And so the next slide we'll go to is eligible populations. So eligible populations to be served is homeless categories 1 through 4, as well as at risk. And so just a brief overview of the process of the PSAP process is households will be prioritized for service through CAS and then be referred to a PSAP site or um, the PSAP organization. The PSAP organization will determine if the household require financial assistance, and they will submit the request to Sacramento Steps Forward. Sacramento Steps Forward will approve it, and then we will submit the check to the third party on behalf of the PSAP site and the eligible household. And so the next slide is going to be just the core functions. And so as I kind of went over earlier, the 2-in-1 appointments and coordination, the financial resource assistance, and then landlord engagement and the prevention assessment and stabilization. And so from here, we're going to go over the deliverables, um, which is to be able to staff and operationalize a team of 6 prevention prevention services teams within 30 days of the contract, um, to be able to handle 2-in-1 outreach appointments and short-term case management, which I believe should no longer be more than 45 days. Landlord mediation, we would like to see just documented by case notes into HMIS to verify that. And then data entry and reporting 100% of enrollments in HMIS within 72 hours and submitting monthly progress reports. And then training and compliance, 100% of the staff under this contract should be certified in HPS, housing problem solving, and as well as the CAS assessor. And then I think at this, I'll be turning it over to my colleague Peter.
Thanks so much, Quinn. And then we'll have time for questions at the end too. But thanks for continuing to drop those in the chat. We'll answer them as they come through, but open up for Q&A at the end. This next section is just around our proposal evaluation. So we'll be looking for um, essentially proposals across this timeline here. Just one thing to keep in mind, because this is funding from HAP 5, all funds have to be fully expended by June 30th, 2028. That is the final requirement. Those who are savvy will note that the contract period does end before that period, right? So just to say that we are looking for submissions to by December 19th. So we know it's fairly quick turnaround here. We will be reviewing those over the holiday period and kind of get it as well as the NOFO period and preparation for the pit. So there's a bit of timing considerations on our end, but essentially we'll be reviewing those and making determinations before the end of January. Then we're looking to enter into contract beginning February 1, 2026, and those contracts will run through January 31st, 2028. We do have an option. It is articulated in the RFP to do sort of essentially kind of no cost extensions through the end of that expenditure period. So if programs are slow to start, cannot fully meet all of the expenditure requirements, we are happy to extend no cost through June 30th, 2028. So just keep that in mind. And then the award announcement will be January 9th, 2026. January 19th, sorry, excuse me. All right, so at a high level, there's kind of three steps to our evaluation process, right? So step one, we do an initial sort of threshold review just to determine if the proposals meet the minimum qualifications and if they meet the proposal submittal requirements. So do pay close attention to that. I'll review that in some brief detail momentarily. And then we have a evaluation scoring criteria. So we'll be looking across five key areas: organizational capacity and readiness, and service delivery model and case management quality. So these two are the aspects that are weighted the heaviest. We are also looking at proposals' ability to make connections within the community and resource network. We recognize that the problem solving access point is not a long-term case management program. And for many folks who access prevention resources, they will need support beyond what a one-time assistance can provide. So we'll be looking in particular to see how proposals can leverage community resources and connections like CalAIM, for instance, and other types of long-term case management that could be leveraged to extend someone's engagement beyond what the PSAP program is intended to provide. So those are things that we're looking at. As noted earlier in the chat, the access and geographic coverage, because this is designed to be accessible across Sacramento County. We want to make sure that we have coverage that doesn't sort of prevent someone's ability to easily access that. And those can be things like mitigated, like having relationships with certain sites in various geographies. It could be providing a model in which you meet clients where they're at, right? There's different ways to kind of get to that coverage, but I think the ultimate thing is trying to create sort of a low barrier approach to allow folks to access these services without too much encumbrance on that household's part. And the last area is around data monitoring and continuous improvement, right? So the ability to make sure that um, our records and outcomes are being input and that we have an ability to monitor progress towards our KPIs and note how continuous process improvements could be applied when we're not necessarily performing or even if we want to improve upon our performance. Last thing is a financial viability. It's also pass fail. So we look at things just to determine the organization's ability to manage this grant and that they have certain requirements met as part of that process. So it is a look at financials and things of that nature. Next slide. So just a little bit more detail, and this is all outlined in the RFP document as well. But some of the minimum qualifications that we're looking at in particular is just experience providing services for at-risk populations, right? We want to know if you've had experience with referral management. And so this can be, you know, from a process of accepting and processing referrals from 211 or similar referral-based systems and being able to engage clients within, fairly short timeframes, right? So we're not looking for engagements that extend, weeks out, but an ability to sort of receive a referral and respond to it timely. Um, and your experience having done that, right? That's not always an easy thing for folks to do. So being able to demonstrate experience or an understanding on how to do that, as well as community-based appointments, right? This idea that be able to meet folks within community or at centrally located sites, and having operating agreements with those accessible community locations. For instance, if you don't have a site yourself in which folks could meet you at, what types of agreements could you have or do you have with other similar sites where folks could access more easily? And yeah, alternatively, being able to meet the client wherever they're located, right? That's the other option here as well. And then in terms of staff capacity, the ability to staff, train, and ramp up service delivery by March 2026, again, recognizing fairly ambitious. So I think, sites who are applying for the full amount, being able to demonstrate your ability to get 6 staff ramped up and ready by March 2026 is another sort of minimum qualification here. From a programmatic standpoint, your proficiency within HMIS, right? Everything about this program runs through HMIS, from the way that assessments are entered, from the way that your requests for financial assistance are entered, from the way that 211 sends referrals and manages appointments. All of that is done through HMIS. So your familiarity and proficiency with the system is critical to your success. Furthermore, the alignment within the coordinated access system, right? So your ability to enroll clients, complete assessments, and log services within that program, while it is true that CAS runs alongside HMIS, and in many cases, a lot of what you're able to demonstrate through that is similar to what you can demonstrate with CAS alignment. I think your familiarity with the coordinated access system and the processes are helpful to demonstrate, and the staff qualifications and caseload management, right? Those are just additional things that we'll be looking for proposals to outline their ability to meet those requirements. Next slide. Furthermore, there are some proposal format requirements, so do pay close attention to these. They're not um, like terribly atypical necessarily, but just take a look, right? So things like your document formatting standards, 12-point Arial font, single spaced with 1-inch margins. Those are all settings that you can set in the document to make sure that you're meeting those. And then do pay close attention to the page limits. We are asking for a maximum of 15 pages, which would exclude your cover page, your table of contents, and any additional required attachments. But the narrative section itself should not exceed 15 pages. And we are asking that you submit all of this as a single PDF document. So those are all things that just pay attention to that. And then there are certain sections within that, as we mentioned, the cover page, which in of itself should not exceed 2 pages. And we are looking for various information around your organizations within that. One thing I think I want to just clarify is I don't think we need your unique entity identifier issued by sam.gov. So that might have been a typo on our end because this is not a federal grant, but we'll clarify that if that was included on the RFP document. Next slide. All right, so in terms of the narrative section around evaluation scoring and your organizational capacity and readiness, like I said, this is all detailed in the RFP, but we will be looking for things like your PSAP and crisis response experience. So being able to provide narrative response there, as well as your administrative infrastructure. Next slide. With service delivery model and case management, we'll be looking at your organization's experience providing case management services to vulnerable populations and your service delivery approach. Within community connections and resources, right? So your ability to resource access beyond the financial assistance. So as I mentioned earlier, what kind of connections can you make to other providers within the community? And what's your ability to connect those clients to wraparound services that can help address additional instances of housing instability? Furthermore, with your collaboration, so what type of collaboration are you already doing within the community, right, to demonstrate your ability to more seamlessly make these connections, and your ability to follow some of the standard assessment, documentation, application processes. Next slide. And with the access and geographic coverage, we're looking at physical accessibility. So is your location accessible to the target population with consideration for geographic distribution? Do you have walk-in hours or same-day next appointment availability? Are there private spaces for confidential client meetings? Do you have a trusted community presence in terms of where a location where clients are already seeking help during times of hardship or a relationship with a program like that? Do you have service areas that are clearly identified and aligned with community needs, right? And so that's to say that, proposals can demonstrate their ability to kind of provide services in hot zones, if that makes sense, right? So where homelessness may be more heavily concentrated or where a specific need for services might be greater than in other communities, right? So you can provide clarity around your ability to do that. And then lastly, with the data monitoring and continuous improvement, as we mentioned before, your proficiency within HMIS and your data quality assurances. So what processes and practices do you have internally to make sure that you're verifying accuracy of your documentation that you're submitting, you're seeking to prevent fraud, and you're ensuring compliance with program requirements, and ultimately working to incorporate client feedback into your service delivery and program improvement model. So those are some of the things that we'll be looking for in your narrative response. Last thing is around the financial viability. So we do ask that applicants, be able to provide various financial and legal disclosures, the proof of signature authority, and the organization's nonprofit status and governance structures. So those will be documentation that we will ask folks to submit, and more information can be found in the problem solving access point RFP. All right, now we've come to the end of the presentation, so I'm going to open it up for questions from the participants here.
So this is Joyce from the Sacramento Regional Family Justice Center. When you say, um, I've read the RFP through and through and through, forward and backwards. And when it says, so let's say an agency applies for the full amount, hire six staff to be able to go to the six service sites. When you say six service sites, what are the six service sites?
So that is up to you to determine, right? So if
Okay.
you say, I am going to operate six sites, or alternatively, right, I'm going to operate some type of approach where staff go out into the community to meet the households at, community locations that are appropriate for them, like a library, for instance, that's
Okay.
close to their home,
Perfect.
or other relationships that you might have already established. So we'll be looking for your ability to sort of demonstrate your ability to kind of meet that geographic coverage. It doesn't have to be specifically like MOUs or relationships with six distinct sites already. But I
Okay.
think when we're looking across, if we were to say get six proposals, we would be looking or multiple, right? If we got 12 proposals, we'd be looking at which sort of collection of these six locations would sort of meet that geographic coverage that we're seeking.
Perfect. Thank you.
And then Peter, I had another question to follow up with that. If an agent is an agency able to submit two proposals, for example, one for the six full sites, and then another one for like let's just say half of that, or two sites or three sites, or is there only recommended to submit um, for however many sites you want to implement?
That's a great question. I think my initial thought is, if your proposal is flexible, I mean, I suppose if you're applying for the full amount, you would want to make a good justification as to why you should be awarded that full amount. I think you could provide like alternatives to say, if we weren't, this might be what be the single site that we would sort of have. But if there's any concern around the interpretation of that or the review, it might be simpler to submit a second proposal that's like, this is this, if we were to only get one, this is what we would sort of lead with. But let me take that back to the team and we'll clarify that through our questions on our website.
Okay, I have a question. If we have already three sites that we allow clients to come in, that we navigate and support as well, and we allow those as access points, and we also deploy three other staff to other community places such as the library in South Sag, in different other locations where we feel as if there's hot spots or as needed spots, according to where the referrals may come from. Is that okay?
Yes, that would be acceptable.
Okay.
I would just make sure you're demonstrating that clearly in the proposal, that you would do a hybrid approach where you would have some site specific sort of magnet sites, right? And then
Yeah.
alternative mobile staff who would go out and fill in the gaps outside of that.
Okay.
Any other questions? And of course, you can also submit questions directly to our email as well if you didn't get any answered today, and we'll respond to that.
Thank you so much. This is very informative. I appreciate it.
All right, hearing no other questions, we'll go ahead and end the recording for today, and we'll be happy to follow up via email with any additional questions. And Ivan, we'll get back to you on your specific question around the number of proposals and guidance around that as well. And yes, the recording will be available on our website.